Hey everybody, my name is Dr. Jocelyn Conley, pelvic floor physical therapist and founder of the Vagina Doc, and in this video, I'm going to walk you through how to perform your own soft tissue mobilization or myofascial release with the pelvic wand for a stiff or restricted pelvic floor. This video is for you if we talked about this in the clinic and I mentioned that the back wall or somewhere else into the deeper layers is stiff. Or it may be for you if you have been in my coaching program and you've done the self-guided tutorials of how to do your own pelvic floor exam and treatment. Or it may be for you if you are seeing another pelvic floor physical therapist and they recommend that you use this tool or another tool to treat yourself in between sessions so that you're continuing to make gains, or so that you have something that you can keep up even after you have been discharged or graduated from formal physical therapy. So I like to use this one, or I like the TheraWand for myself. I like the materials of both. This is softer and lighter. Both are really easy to maneuver. So it's all preference. And then I recommend using a water-based lubricant with this. Intimate Rose offers a really nice lubricant that goes with all the products. Your other options would be a all-natural water-based lubricant like Slippery Stuff or some others out there that do not have glycerin. If you do have the TheraWand, I believe it's okay to use an all-natural oil-based lubricant, which you can use a lot of different stuff for that. So just be sure you're using all natural products. I like to recommend this when there is stiffness in the deeper layers. I recommend my patients use their hand for the outer layers because of the benefit of brain hand. This doesn't have your own sensory receptors versus your hand does. It's really powerful to feel what you're feeling in your hand and internally. So when you can use your hand, I really do recommend that. And then use this for the deeper layers or harder to access layers or muscles like the obturator internus. So I'm going to walk you through three different areas that I often recommend. Things to keep in mind when you do use this. For a myofascial release approach, you're going to just sink into the tissue and wait and follow it as it gives. And you're going to do that for a minimum of ideally 5 minutes to 10 minutes. 3 minutes, things may start going, but it usually takes about 5 minutes for things to even just respond. If you're going to do a soft tissue mobilization approach, then that doesn't have to be as long. Soft tissue mobilization is when you're actually strumming through the muscles, and it's specifically addressing the cross links in the muscle fibers and the muscle proteins versus myofascial releases addressing the fascia. Both are great. It just depends on what you have going on and what your therapist tells you. The other thing is when you are using this, practicing with your hand on learning how to get into the depth barrier if you're doing myofascial release. So you don't want to press too hard that you're through that barrier and that you're getting a lot of resistance pushing back at you. But you don't want to be too light that if myofascial release is what you need, you don't want to be too light that you're not even in the depth barrier. Some women with different pelvic pain problems that, like a vaginismus or certain dyspareunias, the very superficial fascia is what's the problem, and that's even lighter, but will probably be a different video. Just much lighter pressure than if you're going into the deep fascial layer. So let's say I want you to treat the obturator internus. The obturator internus is really off to the side. It slings across like a 90-degree angle, and then if the femur was here, the top of the hip bone or the thigh bone, it attaches to the back there on the upper back part of your leg. So to get to that, you either need a really flexible finger or thumb and hook like this, or you can use a tool like this. I took the outer layers off so that you could see, because I can't insert with those outer layers in. So you would insert the wand like this, back tip up. And FYI, the back tip's just smaller, the back side. If you're really stiff, you could start there and advance to this. Or if you're doing any rectal work, with the thinner side. So you're gonna insert, and then once the first curve is in, you are more than likely you're in layer 3, because that's that's full finger. You're gonna insert, and then you're gonna rotate. So insert straight in with the back tip up, rotate counterclockwise or clockwise, depending on the side that you're treating, so that you are on the side of your hip. Now, you're not in the hip because the vaginal canal is blocking you, but you're in that space. And so this is where you would be. Hopefully you can see that. And then you just sink until you feel resistance pushing back at the tool, and you just wait there for about 5 minutes, maintaining that pressure and trying to sink in. Now, positionally, I often recommend doing this lying down with pillows supporting your hips as they lie out in like a frog position, so that you could fully relax your body. Particularly with myofascial release, you want to be completely present and soft everywhere, or relaxed everywhere, so that you can really sink into these tissues. Now, if you're doing a soft tissue mobilization technique, you should be relaxed, but it's okay if there's less relaxation there. So you may want to do this in standing with one leg supported. It's just up to you. So next, I'm going to cover if you have restrictions up by the bladder. So what you would do is, this time the back side is pointing down, you're going to insert, and then you're going to point the back side down even further and the top part up. And then you're going to go to, if your vaginal canal was a clock, you're going to go to either between 10 o'clock, I believe I'm saying that right. Or no, this would be on you. So it would be between like 5 o'clock and 7 o'clock. You could also be in the center, but be careful because that could be uncomfortable. You want to be really gentle. The urethra is there, the bladder neck's there, and then the bladder's just behind there. So I often will do these types of techniques when there's scarring up here from C-sections or other surgeries. And then I'll have my other hand here, just in front, or scooping it. It's just, you don't have to do that. If you can set your other hand there, great, but no worries if you can't. So again, you probably will be more gentle here than in the other spots, but just wait here for, again, 3 to 5 minutes, ideally 5, maybe more, until you feel like you could sink even further. You got to be present to feel it, and even then you might not feel it at first, and that's okay. Just trust it. Just be consistent with your program. The last spot we're going to cover will be the bulk of the tissues of the levator ani muscles or pelvic floor muscles. And where we're targeting here is here. So when I'm treating, that's like 4 and 8 o'clock. For you, it'd be 10 and 2. So you're going to insert the part that you're using, and you're going to go to 10 o'clock, anywhere around to 2 o'clock. Sink, and you're going to hold 5, 10 minutes. Follow it if you can gauge if it's moving or giving in, and then you could treat the next spot. So if you go straight back to, it would be 12 o'clock on you, you may get to the tailbone. That might be tender. Just be gentle around the tailbone area, but around there is where a lot of the muscles attach, as you can see here. So that often is pretty stiff. So what you're looking for, is the spot hard? Is it tender? If you're assessing with your finger, is it hot? And oftentimes it just takes practice. You don't have to be perfect. Just try it out. Have a conversation with your therapist to see what you could do better, and have fun with it. So we covered how to use the pelvic wand in this video. I hope it was helpful. If you have any questions, please post them in the comments or email me. And again, my name is Jocelyn Conley. I'm a pelvic floor physical therapist, and I appreciate you watching this video. I'll see you next time. Oh, one thing, don't forget, if you like this video, please press the like button. If you know someone that could benefit from watching this video, share it with them. And don't forget to subscribe so you're notified every time a new video launches.